So, starting with the terminology. The terminology is something that they kind of ease you into in the first few weeks, and then it's just expected that you'll understand what we mean when we say things like superior or inferior, okay? Starting with anatomical position. Anatomical position is a state of the body where you stand erect with feet flat on the floor, arms at the sides, and palms facing, eyes facing forward. So imagine a body on a table. It's facing up, okay, its back's to the table, and its chest is up to the sky. Everything's facing forward, including the palms, okay? They're laying down with their palms facing up as well, okay? As you can kind of see here, the palms are facing up. Unless stated otherwise, assume that anatomical descriptions are in reference to the anatomical position. Yes. So whenever we say that something is distal to another part of the body, assume that we mean distal when we're considering anatomical position. So what do I mean by all of these? Let's briefly go through them. So anterior or ventral means toward the front. Okay. This is easy because think anterior literally means more forward, okay? So anterior to the front. Posterior then is to the back. So I might say that my hair is posterior to my neck, for example. It's behind, it's to the back of. Rostral is towards the nose. Caudal is towards the tail, so the bottom of your spine. Superior means above, inferior means lower. So I can say, I don't know, my eyes are superior to my nose, they're above, and then my nose is inferior to my eyes, lower. Medial means towards the center, towards your midline, okay, or mid-sagittal plane. We'll get into what that is in a second. Just know medial is toward. So I can say my heart is more medial than my arm, okay, it's more towards my midline, the center of me. Lateral is more away from the midline, okay, so my arm is more lateral than my heart. Proximal is closer to the origin or point of attachment, okay, so any joints or points of connection. Distal is away from it. Superficial means on the very upper layers of the skin or towards the surface of the body, and then deep is obviously further inside the body. Okay, so you have superficial layers of skin, and then you have deep layers of skin. Okay, again, this is just showing what I said. So proximal, it's closer to the joining point of the hip, and yeah, the hip kind of saddle. Proximal means it's closer to it. Distal means it's further away. Lateral means it's further from the midline. Medial means toward. Proximal, again, distal, anterior or ventral, posterior or dorsal. Cranial, the cranium is your skull. So cranial means towards your head. Caudal is towards your legs and your lower limbs. Okay. Yeah, cool. Hopefully that all makes sense. If it doesn't, please ask a question letting me know I didn't do something or I did. Oh, and superior, higher, inferior, lower. Yeah. Okay. The other thing is planes of section. Okay, so let's start with sagittal or mid-sagittal plane. Actually, no, we'll go in order. So frontal or coronal plane. Our frontal coronal plane sounds really crazy, but I want you to imagine I cut my body in half from here down. I keep going. Okay, that's frontal. Know that this is the frontal bone, so imagine I'm cutting through the frontal bone. Okay, frontal. Transverse is at the hip, okay, or at the waist region. That's transverse if you slice the body and are only looking at the lower half of the body. Sagittal or mid-sagittal is down the middle like this. Okay, just so you know, if you do have to look at cadavers, you will see them cut into these planes. Okay, so I saw like skulls and muscles and whole parts of the body cut down here, and you look kind of, imagine I cut my head down the middle like this with the mid-sagittal plane, and so you will see everything when you cut through the mid-sagittal plane. Okay, so just know that's coming. Yeah, okay. So, movement terminology now. Some of us might know this, especially if we did like PHP or health subjects. There are different types of movement in the body. So, those are the main types. We're going to go over them. Just as a quick little tidbit, if you ever hear your lecturer or tutor or whoever say that a bone is articulating with another bone, it just means where they meet up. Okay, there might be cartilage there or a joint there. Know that they're articulating with each other where they meet up. All right, so starting with gliding movements. These happen when a flat bone moves back and forth and side to side with respect to another. So two flat bone surfaces. Okay, so when I do this with my wrist or this, the two bones are flat and they're gliding along each other. Okay, like that or like that. In gliding joints, there's no significant alteration of the angle between the bones. Okay, because they're just going like this. It's not like they're doing this. Okay, so it's just gliding. Okay, so flexion. Flexion decreases the angle between the articulating bones. Think of this when you swing your leg forward. Okay, you're decreasing it. The angle between your hip girdle and the femur, which is your leg bone, is decreasing as your leg moves upwards. So think of it almost like 90 degrees when your leg is straight. When you kick your foot upward or swing your leg upward, you're decreasing the angle. Okay. Lateral flexion is the sideways movements of the trunk sideways at the waist. So this is what I mean when I say lateral flexion. Okay. Lateral, remember, moves away from the midline. Flexion is when I increase or decrease the angle between the articulating bones. Okay, so this. Extension is an increase between the angle of the articulating bones. This would be when you drop your leg back down to the anatomical position. So imagine this is my thigh, and this is, sorry, I should have explained. This is what I mean when I am doing this. Imagine this is my thigh and this is the hip girdle. When I'm kicking it up, it's flexion, and extension when I'm bringing it back down. Why? Because I just decrease the angle and now I'm increasing it again. Okay, and if I were to keep, I can't do that, but if I were to keep kicking it back, that would be a hyperextension. Okay, so yeah, hyperextension, this increases the angle between the articulating bone. Think of when you move your leg backwards. Oh, that's really hard to do. Backwards, okay? The angle between your hip girdle and femur is decreasing as your leg moves backwards. So this is a better diagram than me swinging my arm around. So flexion and extension, okay, and then flexion and extension. Again, you can do it with your head, flexion, extension, hyperextension. All right, now, abduction and adduction. Abduction is the movement of a bone away from your midline. So if I do this, okay, that's abduction, if I'm pushing it up. Adduction is bringing it towards my midline. So adduction, abduction, adduction. Circumduction is the movement of the distal end of the body in a circle. This happens when there is continuous flexion, abduction, extension, and adduction happening all at once. So this, if I move my arm continuously, you can see I'm doing all of those things because I'm flexing it, and then abduction, bringing it away, and then bringing it back towards, extending it, doing all of those. Okay, so that's circumduction. Again, this is a better diagram than me waving my arm around. So abduction away from that midline, away, adduction toward the midline, circumduction, circular movement. Yeah. We also have, and I'm going to cover this in a second, but while the diagram's here, it would be a good idea to show you. Lateral rotation. Remember, lateral means away from the midline. So lateral rotation is if you, imagine you kind of swivel your leg out. That would be a lateral rotation because you're going away from the midline, and when you swing it back in, you're going toward the midline, so medial. And then rotation, that's really obvious when you rotate something, so like your head. This feels so strange, just moving my body around. Okay, this is for when bones move around their longitudinal axis. We have medial or lateral rotation, okay? So medial, where the anterior surface, remember the forward surface of a bone, of the line is turned toward the midline. So here comes towards the midline. And then lateral is where the anterior surface, let's do it like this, of the bone is turned away from the midline. So if you swivel your leg, the anterior surface is toward the midline, medial, away from the midline, lateral. Okay, like that. Okay. Special movements. Now, these are, special movements that aren't what we just spoke about. These only occur at certain joints. So, elevation is the upward movement of a part of the body. Depression is a downward movement. Best example, shrugging your shoulders. Elevation, depression. Elevation, depression. Protraction and retraction. Protraction is where a part of the body moves anteriorly in the transverse plane. Transverse, remember, is kind of the waist region, and retraction is movement of a protracted part back to the anatomical position. Okay, so protraction, I'm protruding my chest if I'm breathing out, and then retraction, I'm bringing it back in when I breathe, when I breathe in, protraction, when I breathe out, retraction. Okay, then we have inversion and eversion. Inversion is specific, these are both for your feet. Inversion is the movement of your soles so they face away from each other. Eversion is where they face in. Okay, dorsiflexion is where you bend your foot up, plantarflexion down. Okay, hopefully these are really kind of easy to go through. I'm not going to go through all of these, but these are also some terminologies, or terminology that we need to know, especially for bones and cartilage. So angle is obviously a corner. Okay, hopefully this is working. I'm so sorry, guys. I have no idea what just happened. Please, can someone maybe leave a question or just let me know if this is working? My laptop just randomly restarted. It's on full battery, and it just restarted. I have no idea what just happened. My apologies, guys. I really don't know what happened. I will go back to where we were. Okay, so it's working now. Thanks, guys. And my apologies. I have no idea what happened. My laptop screen went black, and then I was just like, is this working? And it clearly wasn't. So let's get back into it. Keep asking your questions because I have been looking at them. Thank you to everyone that let me know that it was down. Hopefully that doesn't happen again because I have no idea what the heck just went on. All right, so let's keep pushing through. An angle, really easy. We know what that is, okay? A condyle is a rounded bump or large rounded prominence, okay, on a bone. So if you see a round part on a bone, we call that a condyle. And I'll show you an example of that when we get to the skeletal system. A crest is a moderately raised and therefore prominent border or ridge. Okay, some bones have ridges on them, don't imagine a bone as something straight. It has bumps and creases on it. So some of them have kind of creases or ridges on them. So that's what we call a crest. A facet is a smooth articular surface, okay? Anywhere where you see smooth bone, it's a facet. Fissure is a long crack-lined hole for blood vessels and nerves. You will see through bones there are almost like a drill has gone through them. There's a hole for the for veins or arteries to run through. Foramen is a round hole through which blood vessels, nerves, or ligaments pass. A fossa is a shallow depression in the bone. Okay, so some bones you will see have a depression in them. They kind of curve down. That's a fossa. Why is there a fossa? Usually we have a fossa when it connects with a condyle. So imagine you have a circular part of a bone and then you have a depression in where it connects with. Okay, so it can go like that. That's why we get fossas and condyles. A head is a rounded projection that forms a part of a joint and is separated from the shaft of the same bone by a narrow portion. A line is similar to a crest but not raised as much. Okay, a line is, think of it as flat. A margin is the edge of a flat bone or a flat portion of the edge of a flat area. So the edge of something flat. Think of, if you have like a flat bone, think of around the edge of the margin. Meatus is a tube-like opening or channel extending within a bone. where ligaments usually pass through. Neck is a section of the bone between the head and the shaft. So think of the head as the top of it and the shaft is the bottom of it. The neck is typically the upper portion of that, but it's the space in between. And then a notch is similar to that depression that we were talking about, but it's a V-like depression. Okay, again, for something to go into. A process is a raised area of projection. This is one that I just want to kind of talk about because I remember when I first heard process, obviously you think something's happening. It's not a process, it's not a series of events. A process is literally when something is raised or projecting outwards of the bone, okay, or tissue. Ramus is a curved portion of a bone, like a ram's horn, okay, think of it curved. Sinus is a cavity within a bone. Spine or spinous process is similar to a crest but raised higher. Okay, so spinous process, yeah, right, it's raised higher, it's more distinct line and a raised line in a bone that's very raised. I'll show you examples. Sulci or sulcus, for one, is a groove, crevice, or furrow, okay, which, again, as it says there, it's likely because some type of blood vessel, nerve, or tendon is laying over the bone, so there needs to be some kind of small depression in it to allow it to kind of fit well in the body. Trochanter is a large, blunt, bump-like projection. Tuberosity is a large, rounded, or oblong projection that may look like a raised bump. And tubercle is a small tuberosity that may also be described as a round nodule or warty outgrowth. Now, some of these things sound very similar, right? Like you can probably think sulcus and sinus sound very similar. Could I call them the same thing? No. Unfortunately, some of these things you'll understand when you're in anatomy. You'll think, but couldn't it also be this? Yes, it could also be that, but because we don't just call things, like for example, if we see a condyle on something, there'll be a specific name for that condyle. Okay, so epicondyle is a condyle in the body. So it's not just like, oh, condyle, there'll be a name for that type of thing. And that's why we can't use them interchangeably, because there's a specific name for each of the things. If that's sounding like, what the heck did you just talk about? Don't worry too much, because once you start seeing the bones and the muscles and everything, you'll start to pick it up. Okay, so let's do a little bit of a recap of the terminology. Now, I don't expect that everyone's going to smash this and get 100%. I expect that we're going to have some right answers, some wrong answers, especially because this is the first time you've ever been exposed to this content. So don't stress too much, but I would like for us to have a shot at this. Which statement do we think is correct? The idea that the neck is superior to the pelvis, the chest is inferior to the stomach, the hip is superior to the shoulder, the ribs are superior to the chin. So remember what superior and inferior mean. Have a shot at it, and let's see how we go. Again, don't stress too much about getting the right answer. Okay, got some answers coming through. I think I might be like a few seconds lagged, so I might just have to wait a few seconds for you guys to kind of catch up. Okay. Just wait a few more seconds. So what does superior mean? What does inferior mean? Okay. All right. Let me just stop that. Okay, so correct answer is A. All right, remember, if something is superior, it means higher, towards the top of your head. Okay, the neck is obviously higher than the pelvis. The chest is not inferior to the stomach. Inferior means below. The chest is not below the stomach. The hip is not superior, above the shoulder. And the ribs are not higher than the chin, okay? All right, next one. Let me just do this. Okay, next one. Which statement is correct? The inside of the thigh is lateral to the outside of the thigh. The shoulder is lateral to the neck. The knee is lateral to the hip. The ankle is medial to the foot. What do we think? What does medial and lateral mean? And again, I'll just give you guys a few seconds. So this is kind of like if you, especially in week 1, you'll be asked about the terminology. After that, it's not really something you'll get like assessed on. It's just something that's expected. But in week 1, you might get, or you definitely will get some questions like this. So this is kind of like a mock what you would do in uni, okay, for anatomy and physiology. So it's pretty good that most of us are getting these questions right. But again, if you're someone that's not getting it right, don't stress, right? You haven't gone over the content. You haven't really started studying for it or anything yet. So it's completely fine. It's just to give you a bit of a taste. Okay, most of us are going with B. All right, correct, it is B, okay? The shoulder is lateral, away from the midline, to the neck, which is obviously toward the midline. It's lateral. Next one, I will start the next poll. Okay, which statement is correct? A, the knee is proximal to the hip. B, the hip is proximal to the knee. C, the shoulder is distal to the elbow. D, the knee is distal to the ankle. And remember, guys, Q&A, to please keep asking questions. All right, what do we think? Okay, started to get some answers in. Okay, I'll give you guys a second. We've got a bit of a split with this one. We've got everyone having all different answers. All right, cool. Correct answer is the hip is proximal to the knee. Okay, remember, proximal means closer to the attachment. And the knee then would be distal to the hip. All right, so yeah, proximal closer to the first attachment, distal moving away from it. All right, tilt your head, bringing your right ear to your right shoulder. What is the movement of your neck? Rotation, lateral flexion, medial flexion, external flexion. What do we think? Oh, sorry, I'll do the new poll. There we go. All right, if we do this, what's the movement of your neck? Is it rotation, lateral flexion, medial flexion, or external flexion? What do we think? Again, I'll give you guys a few seconds just to answer that one. Okay, some different answers. Oh, I just noticed someone said for proximal, when you say closer to the attachment, what do you mean? Imagine where the hip and the femur connect. Okay, so as we go down the femur, we're becoming more distal. We're coming away from that connection or attachment. But if we move upwards, we're becoming more proximal. We're coming closer to that attachment. Hopefully that makes sense. Okay, so answer is lateral flexion. Okay, we're moving away from the midline and flexing our neck outwards. Okay, so lateral flexion. All right, so